Western medicine, we would say, doesn't leave a lot of room for things like the metaphysical, or any room. And a lot of people make a differentiation between Western medicine and pharmacology and psychiatry maybe, and Eastern medicine, which leaves room for energy work or meditation or prayer. And I'm wondering what your experience has been in studying Western medicine and applying principles of Eastern medicine as well, and not seeing those boundary lines.
Yeah, recently I was reading about that and thinking about that. And one of the papers that I read comments about how Western medicine was developed. And Western medicine was developed thinking about disease. Mm. That means the target is treat disease.
Sure.
And when that means the ideal is not thinking about disease, it's thinking about the person. That means I think that is the difference that I see between the Western and the Eastern medicine. They developed it from the other side, thinking about the person, and then try to help that person. I think both approaches are important, and that means that's what I try to do. I try to integrate both approaches and seeing the person as a whole.
And excuse me, to use all the tools available makes sense, right?
Yes, because that's my experience in clinic. You know, like when a patient, for example, is severely depressed. Their brain is not working well. That's why we need to use medication. You know?
Sure.
The concept of mental illness is an old concept. Now we know that every so-called mental illness is in reality brain illness and affecting the mind. What doesn't mean that mind cannot change the brain. Mind also changes how the brain is working. And but when you see, for example, a patient with depression, one of the things that I notice a lot is that their level of energy goes very down. They become very withdraw from their environment. But one of the other things that happens is usually their spirituality is decreased a lot.
And how does that show itself?
That is very interesting. Recently, this week, I saw a patient that was very much involved in religion, part of her church, and very active in her church. And interesting is a church that doesn't accept medication that easy, and doesn't kind of try to solve the problems only with spirituality. But she got so depressed that she could not participate on that church anymore. And she came to us, and one of the things that I explained to her is that what's happening with her is that with the depression usually blocks, that decreases the level of spirituality of someone. And as we would help her, she would probably regain that, and her spirituality would come back, and she would be able to even return and be very active to her church. And I have many cases like that, where people lose their hope, they lose their ability to thinking in terms of spiritual levels when they are severely depressed. Once you treat them, that comes back, and it's a neat thing, and it's very important for the development of hope.
Yeah, and it highlights the interconnection among all those pieces with not one at the top, it sounds like, not a hierarchy of this is the most important, mind is the most important, and then body, and then spirit, or spirit is the most important. That one can't dominate the others to make an instant change, but you have to have the interplay among them.
Yes, yes.